Next, let's welcome our next speaker, Nurse Jun from Taiwan, talking about new patient education model in PD of National Taiwan University Hospital.
Hello everyone, my name is Jun. I am from Taiwan. Today I'm going to talk about our new patient education model in PD of National Taiwan University Hospital. First of all, let's take a look of our operation model, which we followed every day here. Whole process begins from pre-dialysis education, through catheter implantation, to new patient education, and monthly follow-up. When CKD patients enter stage 4 or 5, our nephrologists would make a special appointment for them. Doctors and nurses would introduce every renal replacement therapy in this pre-dialysis education class with leaflets and videos. Patients were encouraged to ask any questions that they concerned. After pre-dialysis education, if the patient chooses to do PD, they would undergo a surgery to implant the Tinkoff catheter. PD nurses would work with our surgeon to make sure the function of the catheter. Then, they will be discharged in 4 days. In order to improve healing, usually it takes 2 to 3 weeks before starting PD therapy. We would let the patient and their family come back to PD room to start PD training during this period. Training topics include orientation about hospital environment, patient rights, safety, hand washing, and pain control policy. Also, skills about PD solution exchange, wound care, diet and nutrition education, medication education, emergent incidents, and other important instruction for doing PD at home. We would provide patients a schedule of training process. It is also a checklist for primary nurse to see if patient achieved the basic standard of each item, so that we could regulate the training speed accordingly. Usually, we teach practical skills before heading to knowledge list here. However, some of our patients could tolerate uremia symptoms for even a year after catheter implantation. In this situation, they would just come back monthly to review their skills. When the day comes, we could start to teach them all the knowledge they need to know then. In order to get a successful training outcome, we provide quiet and private room for our patients and try to create a warm and bright atmosphere by managing colors and lights. In our fluid management room, there is a camera to help monitoring patients' practice and keeping their safety as well. For teaching quality, we emphasize one-on-one teaching style. Every patient has their own primary nurse to help them handle all the training stuff. For patients with good social support, we acquire their family members to learn together. Sometimes we need to teach their foreign caregivers as well. In Taiwan, a lot of home care service were provided by migrant workers coming from countries in Southeast Asia. So, we also prepare multi-language leaflets to teach them. These are all the useful tools for giving a good training course. We have well-structured instructions in not only Chinese, but also in English, Vietnamese, and Indonesian for foreign caregivers. There are videos and pictures for skills learning too. Patients could watch particular clips repeatedly at their home to reinforce their memory. With the help of bigger pictures focusing on details, they could learn more easily step by step. For demonstrating the skills, we use little model to show patients how to change PD solution and perform wound care. Patients could also use the model to practice before really doing on themselves, including automated peritoneal dialysis machine. For tank-off catheter care, important details were highlighted in posters with these 5 no rules here to prevent infection and improve catheter safety, such as no scratching or bathing for preventing wound infection, no compress or pulling for reduced risks of granuloma formation. These are all based on real situations that happened in our units before. In order to increase training accessibility, we set up a QR code system with educational resource. Patients could use their smartphone to review these skills at any time, any place. Before starting home PD, all essentials were listed in a paper. PD nurse would explain the reason why they need to prepare certain things and the correct way to use and store them. Emergent events like peritonitis, hemoperitoneum, catheter rupture, and so on were illustrated. Patients need to know how to deal with these situations in advance to prevent panic at home. Early detections of signs and symptoms by themselves were so important for timely treatment. This also reinforces their confidence of caring themselves at home. To enhance patients' sense of security, we provide 24-hour telephone consulting service. On weekends, holidays, or even at nights, they could have a reliable helping resource when they have problems doing PD at home. We'll record the events and hand it over to their primary nurse. There are 460 patients in our center so far. Averagely, 35 phone calls were answered every month last year. When they come back for monthly appointment, primary nurse would assess their nutrition and fluid status firstly, and check wound condition before they go to see their doctor. Giving diet education and discussing solution adjustment with patients are largely depending on PD nurses in our center. That's how we cooperate with our nephrologists. Once the patient starts to enter long-term PD therapy, all patients and their main caregivers have to take a retraining course every 6 months, including knowledge related to peritonitis and exchange technique as well. For patients with peritonitis, we increase retraining frequency at first and 3 months right after peritonitis happened. In this way, a deep impression of peritonitis prevention was made on them. And the PD customized electronic medical system, which is called PDS in our hospital, also helps us a lot in patient management. Here is an example. When we retrain a patient, the result of our assessment in environment preparation, exchange skill, and knowledge aspect could input the system. The data could then output as a report, which could make a comparison of previous performance more efficiently than before. And another special course is our outdoor education. We used to invite our patients to have a one-day tour with us every year. We would teach them things they have to notice when exchange dining outside their home. During prized quiz time, some important issues like low-phosphate diet, fluid control, and peritonitis prevention would raise up. From their feedback, this actually helps them build their confidence in traveling a lot. And this is the end of my speech. Thank you very much.